Hi, I'm Dr. Miladys Palau, and I'm a pediatric endocrinologist. In honor of Diabetes Awareness Month, I wanted to discuss with you key differences between type 1 and type 2 diabetes. I'm going to start with the cause. Type 1 diabetes is an autoimmune condition, meaning that your immune system, instead of attacking something that doesn't belong to you, like a virus or a bacteria, starts attacking something that does belong to you, in this case, the beta cells of the pancreas, which are the ones that produce insulin. Type 2 diabetes is a metabolic condition, meaning that your body is resistant to the insulin or not producing enough insulin to maintain normal blood sugar levels. In terms of insulin production, type 1 diabetes patients can no longer produce insulin, but type 2 diabetes, they do still produce some insulin, although it might not be enough. In terms of risk factor, we know with type 1 diabetes, you can have a family history. We know that you have a genetic predisposition to develop type 1 diabetes, and there are environmental factors that can be causing type 1, but unfortunately, we still do not know the cause of type 1 diabetes. With type 2 diabetes, you can also have genetic factors, so we know that people can have a family history of type 2 diabetes. Lifestyle and problems with your weight can also predispose you to develop type 2 diabetes. In terms of prevention, unfortunately, we don't have a way to prevent type 1 diabetes, but the research community is definitely working extremely hard to find ways of preventing type 1. With type 2 diabetes, although there are times that it cannot be prevented, we know that staying active and eating healthy definitely helps to prevent type 2 diabetes. In terms of treatment, since patients with type 1 diabetes no longer produce insulin, they're dependent on insulin injections, and they have to monitor their blood sugars often, versus type 2 diabetes that you can do lifestyle changes. It can also be treated with oral medications and occasionally has to be treated with insulin injections. Thank you so much for your attention.